Hi, I'm Catherine, a member of the SWAT team. It is really important to look after your wound or scar to ensure successful healing. Most patients will have a surgical Aquacel dressing on their hip wound. This is a gel dressing that covers the wound and has a flexible, bacteria and waterproof covering that sticks directly to your skin. The gel layer absorbs any blood or fluid leaking from the wound, and the waterproof covering keeps the gel dressing in place and protects the wound. Your dressing can remain in place for up to 14 days from placement in theatre, but some patients may need their dressing to be changed sooner, depending on the amount of fluid it absorbs. Dressings are only changed when absolutely necessary, as every time the wound is exposed, this can increase risk of infection. The release of blood or fluid from your wound after surgery is completely normal. As the gel absorbs this, the dressing will swell slightly and you will notice staining under the waterproof cover. When the gel dressing becomes fully saturated or has reached the border, it is time to have your dressing changed. If your dressing needs to be changed whilst you are still in hospital, nursing staff will change it. If you have been discharged and your dressing needs to be changed, please contact SWAT, who will change your dressing at home. The dressing on your hip is waterproof, so you can shower when it is safe to do so. Although it is showerproof, it is recommended to keep it as dry as possible, as the dressing will only stick to dry skin. When showering, place your back to the shower to avoid the shower directly going onto your dressing. Your dressing will normally stay on for 12 to 14 days after your surgery. By this time, your stitches will have dissolved and the wound will be healed. A member of SWAT will remove your dressing, and if there are any tail end sutures visible, they will be removed. The wound will now be ready to be exposed. It is important that you contact SWAT if any of the following occur. If the dressing is fully saturated and has reached the border or leaking out of the dressing. If the surrounding skin has become red and is spreading outwards. If there is an increase in pain or odour. The dressing is moved. If blisters develop around your surgery site. Remember, we are here throughout your joint replacement journey, so please don't hesitate to contact us if you have any questions or concerns.